Hello and welcome to today's webinar, Clinical Applications of Z-Wave Post-Cryolipolysis and for Cellulite. This webinar is presented by Zimmer Aesthetic Division. I'm Regina West and I'll be moderating the webinar today. During the presentation, you may submit questions by typing them in the Questions tab on your webinar control panel. If there's time following today's presentation, we may be able to cover those questions during the webcast. If there's not enough time remaining for Q&A, answers will be emailed to you. I'd now like to introduce the presenter of today's webinar, registered nurse Tammy Holton. She specializes in laser and skin care. Tammy graduated cum laude from Barton College in North Carolina with a bachelor's degree in nursing and has been practicing nursing for over 20 years. Tammy began her nursing career working with cardiac patients, including heart transplants and the artificial heart program in Louisville, Kentucky. She then worked for GlaxoSmithKline Pharmaceutical Company in North Carolina as a corporate nurse. In 2005, she began working with lasers and cosmeceuticals. Since 2010, Nurse Holton has worked with Dr. Brian S. Beisman at his renowned practice in Nashville, Tennessee. She's played a pivotal role in the development, testing, and launching of numerous technology-based devices and topical products. Tammy has a passion for education and has participated as a faculty member in Music City Scale for many years. Welcome again, everyone. Nurse Holton, thank you very much for being with us today.
Thank you for having me.
I will now give you control of the presentation, Clinical Applications of Z-Wave Post-Cryolipolysis and for Cellulite. Give me a moment. And we should be able to see Tammy's screen in just a moment. There we go.
All right, hello everyone, and thank you for your interest and for taking time out of your day to join us for this webinar. I'm going to present information on the Z-Wave by sharing my experience that I have had over the last 4 years using this device post-CoolSculpting and more recently in treating cellulite. My goal today is to help each one of you to get the best possible results in your CoolSculpting treatments and to realize the true value that the Z-Wave brings to your patients and to your practice. So what is the Z-Wave? Well, it is not a laser or an ultrasound as many patients think it is. It's actually a deep tissue massage. And if you were to look inside the handpiece, it's actually 2 pieces of metal slamming against each other to create a shock wave of energy that results in a deep tissue massage. It's an awesome addition to many of your treatments to improve overall results. It was initially used in physical therapy and is now being used in many ways, including treatment of cellulite and most commonly immediately following body contouring procedures. I believe we will continue to find new uses for the Z-Wave. So I want to briefly mention Zimmer's gold standard for cryotherapy, which is their powerhouse chiller. Most of you are probably familiar with this device. It blows cool air and it's fabulous. We have a large office with over 4 rooms full of lasers and equipment, and my favorite device in the entire office is the Cryo 6. It's a cold air device that minimizes pain and thermal injury during laser and aesthetic treatments. We actually have 3 in our office and they are all used regularly. The cool air is a great distraction and can be used while performing many treatments, including IPL, ultherapy, chemical peels, PDT with blue light, and after the completion of most laser treatments for its comforting effect. In this video of Dr. Beisman performing laser tattoo removal and using the Cryo 6 for cooling, you can see that it's easy to use, and honestly, I think as valuable as the Cryo 6 cooler is in our office, I believe we will continue to find the Z-Wave increasingly useful in multiple ways as well. And so here's our Z-Wave, very sleek, easy to roll, simple to use. There's no consumables, which is always great. And as you can see, each unit comes with 2 handpieces. With the Z-Wave technology, the pressure waves are transmitted through the surface of the skin and spread radially into the tissue, affecting a large and deep treatment area. There are 2 handpieces on each device, and they are available in 2 different sizes. The smaller handpiece will only be used on small treatment areas, such as the submental area post Cool Mini. You will usually be using that larger handpiece. This large tip makes treatment fast, delivers more energy so that it is able to penetrate deep into the fat tissue, and therefore avoiding dermal complications such as bruising. And as demonstrated in this video, the energy penetrates the skin layers, creating significant impact, which improves blood circulation and reduces size of fat cells. So today we're going to focus on Z-Wave's use to treat cellulite and its use post CoolSculpting, but other practice also use the Z-Wave after their Kybella treatments, sculpture, and liposections to enhance results as well. But let's talk about treatment of cellulite. So cellulite's a major concern for women, and although we know there's no cure for cellulite, it can be treated. And the Z-Wave is FDA cleared for treatment of cellulite. The most common areas treated are the abdomen, the hips, and the thighs. And to treat cellulite with the Z-Wave, we recommend that you perform 2 treatments a week for 5 weeks for a total of 10 treatments. You can mark off the treatment zones. You want that treatment zone to be about half the size of a sheet of paper, so about 4 inches by 6 inches. And this is going to take you about 3.5 minutes per zone to deliver that treatment. You can have the patient undress and use a marking pencil to mark your areas, making sure that you use the Zimmer oil when you're delivering treatment directly on the skin. And then if women arrive at their appointments in leggings or tights, then the treatment is administered directly over their tight pants. And this allows for quicker treatment due to patients not having to undress. So to show the efficacy of the Z-Wave treatment for cellulite, 2 studies were done by Dr. Garcia in Spain. The first study used thermography images to show the effectiveness of the Z-Wave on cellulite. And this top photo is pre-treatment. You can see that it's dark. The dark image indicates poor circulation and cooler temperatures. And then the bottom photo was taken several weeks after 10 treatments, and the green color shows warmer temperatures and increased circulation. And then in this second study, this used ultrasound images to show the effectiveness of Z-Wave treatment with cellulite. The top photo is pre-treatment. The white areas show enlarged fat cells, intracellular fluid, and irregular skin surface. And the bottom photo was taken after 10 treatments, and the overall improvement includes a smoother surface to the skin. Now we're going to look at some slides that are photos of before and after pictures using the Z-Wave to treat the cellulite. These are not my photos, but the improvement is visibly noted, and I think that's a really good picture. This slide just shows it's a close-up picture photo of that same previous treatment, of that same previous patient. Really good results. And by using the Z-Wave's radial shock waves, you can see reduction in the appearance of cellulite. This is an amazing before and after picture. Like I said, not my patient, but you can see by the mole on her right upper thigh that it's indicative of being the same patient, but definitely really good results. And then this photo shows treatment of cellulite to the abdomen. The lower abdomen, you can see that lift definitely there. Good pictures. And now let's talk about using our Z-Wave as a massage treatment immediately post CoolSculpting. So the love handles in this photo were treated with CoolSculpting, and on the left side, a hand massage was delivered, and on the right, a massage was given using the Z-Wave technology. You can see the huge difference in the less amount of fat remaining on that right side. And you all, this is why I love the Z-Wave and get such amazing results with most all of my patients with their CoolSculpting treatments. Huge enhancement to the results with CoolSculpting. So this is Dr. Beisman. So I started working with Dr. Beisman in early 2010 and have been performing CoolSculpting for over 8 years. Our office was one of the first in the country to offer CoolSculpting. Dr. Beisman has been on their medical advisory board since before it was FDA cleared, and he continues as an active member. We have participated in research studies to expand the use of CoolSculpting and their various handpieces. And CoolSculpting actually uses my before and after photos for their marketing material as well. All that to say, I've done a lot of CoolSculpting. And in 2014, I was introduced to the Z-Wave and was asked to try it using it post CoolSculpting instead of performing the manual massage. And here is a video. People are always asking, wanting to know how I actually use the Z-Wave post CoolSculpting. So this is a video that demonstrates how I use the Z-Wave with CoolSculpting. So you want to remove your CoolSculpting applicator and place your patient in a comfortable position. Apply the Zimmer liquid, which is plain mineral oil, to your treatment area. The oil allows for a smoother treatment. If you try to use that Z-Wave on dry skin, it's more uncomfortable for the patient and it just doesn't glide smoothly. So you want to use your mineral oil and you want to deliver a full 2,500 pulses, which is going to take you about 2.5 minutes to each treatment area. As most of you know, the Z-Wave's loud, so tell your patients before you begin that it's loud and sounds like a jackhammer. I always let them hear the noise before I start the treatment, but it's actually tolerated very well. No one minds the noise. As you use your handpiece, apply a moderate amount of pressure. So you can see in the video, you don't just want to glide topically over the skin real lightly. You want to apply some pressure and make sure to cover the entire treatment area of erythema. So go beyond just that butter stick area. You want to make sure you get full treatment to that area. And move the handpiece in all directions. You can go up and down, back and forth, circular motions as well. I believe this helps to give a smooth contour to your patient and diminishes any risk of irregularity at the treatment site. The Z-Wave is not comfortable for everyone. Some areas are more sensitive than others, and each patient's experience is different. If it's uncomfortable, you have the option to turn it down, but I never do. My patients know how important the Z-Wave is for their transformation, and therefore they never want me to stop the treatment or decrease the energy. And remember, our goal is to help our patients achieve the best results possible with CoolSculpting, and they trust us to help them reach this goal. So I use the Z-Wave after CoolSculpting on all areas of the body: abdomen, love handles, back, inner and outer thighs, upper arms. I also use it when I treat the smaller areas such as the axillary puff and the submental region with the Cool Mini. I used to use the large handpiece when that was all that was available to treat those smaller areas, but sometimes I will use the small handpiece. I usually don't deliver a full 2,500 pulses if it's a small area like the submental area. A lot of times I'll only do 1,200 to 1,500 pulses, but the patients tolerate it very well. And I always use the Z-Wave after the Cool Mini treatment. And then at the end of your massage, simply wipe away any oil residue from the blue cap and place the handpiece in the holder cap side down. You want to avoid any oil entering the vents on the handpiece and wipe off your patient's skin and continue with subsequent treatments. After each patient, make sure you wipe the blue cap with alcohol. Don't use Sandy wipe since that can destroy the plastic. And I will add my usual settings, as you can see on the screen, to use the Z-Wave post CoolSculpting. I usually use 120 millijoules, 16 hertz for a total of 2,500 pulses per site. Very well tolerated by patients. So this is some of my own before and after photos of patients being treated with CoolSculpting and using the Z-Wave as a massage immediately post-treatment. So this gentleman's love handles were treated once, and this picture was taken 3 months after treatment. Really good results. This lady's abdomen was treated once, and this picture was taken 3 months post-treatment. This gentleman's abdomen was treated once with 2 cycles of CoolSculpting, and this picture was taken 3 months post-treatment. This is another of my favorite photos. Her photo is actually being used in the most recent CoolSculpting brochure. They've cut out her sports bra, but you can look for her in the most recent brochure. She actually had more than one treatment with CoolSculpting to her abdomen and love handles, but had amazing results. What I want you to recognize is that these before and after pictures of my patients portray what we see every day in our office. We want our patients to be amazed with their results so that they return to the office, that they tell others about us, and so that we can obtain amazing before and after photos to use for our own marketing purposes. When I first started using the Z-Wave with my CoolSculpting patients, I was truly surprised by the impact it made in my final results. I continue to be impressed with the Z-Wave because it is easy to use and provides consistent results when administered post-CoolSculpting. I prefer the Z-Wave over the hand massage because I've found that hand massages are not consistent due to the varying amount of pressure applied by the hand and the chance of not completing a full 2-minute massage. What I have found with my patients is that they have less bruising, less discomfort, less swelling and numbness when I use the Z-Wave. I truly feel that it decreases any risk of post-complications. Overall, the Z-Wave increases blood flow back to the treated area and helps to break up the fat after it has been frozen, therefore enhancing the outcome and recovery following body contouring procedures. And some simple maintenance guidelines for the Z-Wave. Remember to use the Zimmer oil, which is plain mineral oil. Don't use ultrasound gel as it will clog the fan in the handpiece. And after each treatment, clean your blue caps with alcohol and change the blue caps when they become loose or torn. Check your metal tip as well on the applicator head and replace that every 500,000 pulses or less if needed. I hope this has been helpful to you all, and we should have time for some questions.
Yes, thank you very much for your presentation today, Nurse Holton. Your before and after pictures are just remarkable. We do have some time for questions, and there are some queuing up already. Let's get right to it. Here's the first question. Nurse Holton, do you ever not use the Z-Wave after CoolSculpting?
No, I always use the Z-Wave. If my Z-Wave was not working properly, I would reschedule my CoolSculpting patients. That's how strongly I feel about the additional effectiveness of the Z-Wave. And I will never treat patients with CoolSculpting without also using the Z-Wave. I feel that it just makes that much of a benefit to their results.
Okay, next question. Do you think using Z-Wave decreases your patient's discomfort post-CoolSculpting?
I do. I spend a lot of time during my CoolSculpting consultations to explain the treatment and the Z-Wave massage in the post expectations. So the patients have been made aware of probable numbness and discomfort after CoolSculpting, but using the Z-Wave, I feel like significantly decreases their degree of these symptoms. And I rarely get a phone call from patients having unexpected symptoms or complaints.
Okay, next question is, what do your patients say about the Z-Wave?
Some think that it's uncomfortable, but there is more discomfort around the edges of the treatment area, where the center part of the cold area of your treatment area after CoolSculpting, where it's still really cold, it's more tolerated there. When you get toward the outskirts of the treatment area, it can be a little bit more uncomfortable, but all my patients agree that it's well worth the results. And like I think I mentioned earlier, no one ever wants me to stop. No one ever wants me to turn the energy down. And I have pictures of my before and after CoolSculpting on the walls of the treatment room where the patients are. And their goal is to get their photos on the wall. They want to be on our wall in the CoolSculpting room. So they know how strongly I feel about the Z-Wave. And so there's never a question about how patients tolerate it. They do well with it.
Okay, we do have a question about settings. I think you touched on this. One of the attendees would like to know more about the energy settings. What settings do you use?
So I always use 120 millijoules and 16 hertz for a total of 2,500 pulses at each site. You can do more, that's what I do post CoolSculpting. You can do more pulses, but that's about 2.5 minutes, and that seems to have always worked well for me.
Okay, and I believe this question came in during some of your before and after pictures. An attendee would like to know, after how many treatments can you get these kind of results?
Well, the first 3 photos, they were all just with one treatment.
Okay.
And then that's the last photo of the lady. She had 2 treatments. She was treated twice to abdomen and love handles, but the first 3 patients were treated one time.
Okay. Next question. Can you repeat your cellulite protocol?
So typically with cellulite, your first treatment, I usually use the same settings that I use for the CoolSculpting, which is 120 millijoules, 16 hertz for a total of 32 pulses, which is more than what I use for CoolSculpting. So I use 3,200 pulses, and that's per area of treatment. So that's per like a 4 by 6 inch area. And then when they come back for that second treatment, you can increase that settings to 107 up to 170 millijoules, and you'll decrease down to 10 hertz for the same total of 3,200 pulses. And that's typically 2 treatments a week for 5 weeks for a total of 10 treatments. I wouldn't use any energy any less than 120 millijoules. You could gradually increase that if the patient was tolerating it well, up to 170 millijoules.
There are actually a lot of questions coming in, Tammy, about settings for cellulite and then post CoolSculpting. So that is of high interest to our attendees. Okay, here's an interesting question. Would you use this on the face? And if so, what areas and settings?
Well, you can definitely use it under the chin in that submental area. And I would use the same, if you're going to use it post Cool Mini or Kybella, I would use it the same settings as I normally do at that 120 millijoules and the 16 hertz. I wouldn't do as many. If you're going to do anything on a small body part like that, I would definitely use that smaller handpiece. But you just want to do, you're going to do less pulses, and you're not going to press as hard as you're not going to have as much pressure to the handpiece like you would if you were doing a love handle or a outer thigh, a larger body part.
Okay, I'm going to combine a couple of questions here that have come in sort of on the same topic about charges for the Z-Wave. Do you charge additional for Z-Wave treatments after CoolSculpting? And the second part to that question would be, what do you charge for 10 treatments for cellulite? How much is the Zimmer oil? And do you have to refill pulses? How much? Sort of about ongoing cost and charges for treatment.
So I do not charge anything additional for the Z-Wave after CoolSculpting. I never charge for that. We don't charge for anything post-treatment. We're not going to charge anything additional with the Z-Wave. The fluid that you're going to use when you're using Z-Wave on the skin is just mineral oil. So you can go to, I picked some up at Walgreens a couple of months ago. It's a large container and less than $10.
Okay, we have time for 1 or 2 more questions, I think. Are you able to retreat sooner by adding Z-Wave?
I think that it just depends on the patient's end result with their CoolSculpting. So typically, according to CoolSculpting, you can retreat them the next day. You don't have to wait a particular length of time. You can take that CoolSculpting applicator off and retreat the area. You don't have to wait. But a lot of times my patients will get their results quicker, I feel like, with the Z-Wave. And so therefore you're able to, if the patient has a certain date in mind, say a wedding or a specific date that they want to get best results with, you certainly can retreat sooner.
Okay, let's do one last question. I have heard about numbness post CoolSculpting treatments. Do you find that Z-Wave makes that less severe?
I think that the Z-Wave, the patients are going to be numb after CoolSculpting for a good 2 or 3 weeks. Typically, that varies from patient to patient, but I do feel like using the Z-Wave decreases all of the symptoms that they're going to feel post-treatment. So any discomfort, any swelling, or any numbness, I feel like it decreases that times some.
Okay.
But what we want to remember too, Regina, with CoolSculpting, these patients come to us and they're wanting to get the best results they can with their body contouring. So, I feel like I owe it to the patient to do everything I can to give them the best results. That's why I make sure, I do a really good consultation. I make sure that their expectations are appropriate. And then we make a plan of care for them. And I feel like if I don't do the Z-Wave, I'm not doing everything that I can to give them the best results. And that's what the patients are paying for, and that's what their desire is. So when by using the Z-Wave, I feel like I'm doing everything I can. We know there's no guarantees. Some patients respond better than others with CoolSculpting and any body contouring treatment that we're giving. But by adding that Z-Wave, I feel confident that I'm doing everything I can to give them the best result possible.
Okay, great. Actually, it looks like we may have time for one more question. So let's do one last one. I was told by a rep that cellulite treatments can be done daily. Is it better to do X times per week?
It's really from everything that I have read and heard and talked with Dr. Beisman as well. There's no harm in doing the Z-Wave daily. It really becomes up to you. And as you use your Z-Wave to do your cellulite treatments, you'll find what you feel like works best for you. There's no harm in using it every day. It's usually more of a scheduling issue of getting the patient, how often they want to return back into the office. That's why it seems to be more just the ease of scheduling and the patient coming in to do it 2 times a week for 5 weeks, but you're not going to harm the patient by doing a treatment once a day.
Okay, thank you so much for your insight, Nurse Holton.
You're welcome. Thank you for having me.
If anyone would like more information about Z-Wave and Z-Wave Pro, please visit Zimmer MedizinSystems website at www.zimmerusa.com. You may also visit shop.zimmerusa.com to purchase accessories and marketing materials for your Z-Wave device. This concludes today's webinar. Thank you very much for attending. A recorded version of this webinar will be emailed to all attendees so that you may review any of this information at your leisure. Good night.